Assalamu alaikum, the communication day. The scenario, you are the internal medicine registrar in the cardiology ward. You have been asked to speak to a patient, Mr. Brandon Adam, 40 years old, who has recently undergone angioplasty with stent placement following severe chest pain. The patient is diabetic, he's a smoker, and has a history of alcohol dependence, currently in a rehabilitation program on chlordiazepoxide. The patient is insisting to be going home and wants to continue taking chlordiazepoxide at home. He also wants to know what medication they will be prescribed upon discharge. Are you ready, Dr. Rhoda?
Oh, all right.
Okay, here you go.
Yeah. Hello there. I'm Dr.
Hello,
Zain.
doctor.
Yeah. I'm Dr. Zain, one of the doctor in the medicine heart department. Am I talking to Mr. Brandon Adam?
Yes,
And you are a 40-year-old.
yes, doctor.
Yeah. We are here to discuss issues related to your health condition. Is that all right?
Sure, doctor.
Yeah. And yeah, before starting, just to be on the same page, how are you knowing about your condition so far?
Actually, doctor, I was quite well.
Mm-hmm.
Just for a few days back, I have this trouble chest pain. Actually, this is the worst chest pain I have felt ever, and I thought I'm going to die.
Really sorry.
However, yeah. So thank you. So and I went to doctor, and he told me that I'm have a heart attack.
Hmm.
And they yes, and they think now I'm in front of you.
Yeah. I'm really sorry for what you have been passed through, and I'm pleased that you are okay right now. And yeah, so what do you think that we are going to talk about it right now?
I feel fine now, and I think so. You're going to give me some advice and just give and discharge me home.
Yeah. Because they told me that you want to speak with me about this issue, that you want to go home. Am I right? Um,
Yes,
yeah. So you told me that you have been passed through this heart attack, and they fully explained for you what is this heart attack. Am I right?
yes,
Yeah. And I'm pleased that you are all right, because it is a life-threatening condition, really. And they did for you a procedure. As you know, they made like like they dilating your blood channels. Uh, uh, and that is why you are still here in the hospital. Are you with me till now?
yes, doctor. They told me they
Mhm.
done some procedures, but I'm not sure what they did exactly.
Yeah. So you want me to explain it?
Yes,
Yeah. Actually, they did what's called angioplasty. Don't bother yourself with this term. Let me draw for you. If this is the heart and this is the blood channel supplying blood to the heart, when it get narrowed, you have this condition or plugged, which is the heart attack. So we need like to dilate it or to increase its width, and that is why we put something like something like to make it a tube, a small tube, just to dilate it. We call it a stent, and hence to let the blood going to the heart smoothly. And this exactly what they did, and that is why now you are okay, and you relieved from this chest pain. Are you with me till now?
yes, and thank you. Really, I do appreciate your effort, doctor.
Yeah.
And that's why now, yes, I feel completely fine now,
Mm.
and even I don't have this chest pain. So um,
Mm.
just I'm going to, just now I'm planning to go home, doctor. So if there is any papers or any card you want to give me, just give me and let me home.
Yeah. The issue is, Mr. Brandon, that you need to stay in a hospital for a while. Uh, doing this kind of a procedure and passing through this heart attack is not something easy. You need to stay in a hospital, because sometimes after this procedure and sometimes after this heart attack, you may get some complication, though it's rare, but it might happen. For example, you may get like an abnormal heartbeat. You may get like a fluid in your lung. Whatever. You need to be like to stay in a hospital for further monitoring and tell you exactly the right time for going to discharge. Is it okay with you, Mr. Brandon?
No, doctor. No, because I want to go home.
Mhm.
It's not okay at all.
May I know why? Do you have any concern in the hospital, at home?
Yes,
When you
doctor. I'm afraid. Now I feel okay, and
Mm.
at the same time, I'm afraid that I might got or I have any bug infection from your hospital.
This is totally appreciated, but here in our hospital, we apply the full infection control and a good hygiene in the hospital. So I want to assure you from this point, you are not gonna get any kind of like a bug infection from the hospital. Is that all right with you?
Okay, so for how long should I stay in the hospital?
This is kind of a difficult question right now. Some may stay for a few days, but it depends on the patient, like recovery and yeah, it differs from patient to patient. And we are gonna update you as soon as we want to discharge you. All right?
Okay, okay. So,
Yeah.
so how you are going to help me? Do I need to take anything else apart from this procedure?
Yeah. Actually, I wrote in your note that you are already on a medication called Chlordiazepoxide. They gave you have the nurse explain for you for what this medication?
Yes, they told me because I was drinking alcohol for a long time and just decided to stop it.
And what do you think about stopping alcohol, Mr.
No,
Brandon?
yes, I feel fine. That I completely convinced that I should
Mm.
stop alcohol.
I'm really pleased to hear that. Actually, this kind of medication, do you want me like to explain further about it?
No, they already explained for me about this medicine.
Yeah. So you are gonna take it in a hospital, all right? And we will gonna like consult the team if you need like to continue it at home when you are gonna be discharged. All right? And they told
Okay.
me, yeah, I wrote in your note that you are a heavy smoker. So what do you think about smoking?
I'm going to be smoke cigarette, doctor.
So what do you think about stopping smoking? Is a hazardous to people's health, and it could be related directly to the heart attack that you have.
Okay, okay. I will think
So
about it.
I'm really pleased for this, and we can help you by referring you to the smoking cessation clinic in our hospital if you don't mind. All right?
Okay.
Yeah, all right. And yeah, I want to assure you that you are now under the control of a group of a specialized team, including the heart doctor, and you also you know that you are a diabetic patient. Also, they will gonna like control your sugar. We'll see the smoking as we spoke about it, and I'm pleased that you convinced and for stopping this alcohol.
2 minutes
And
left.
with a specialized nurse also, we are going to follow you and monitor you. Even after you are going to discharge, you will be under control of our team. And also, have you heard about something called a cardiac rehabilitation program?
Oh, what is it, doctor?
Yeah, it's a program with a specialized team, all the team that I said, with others that will gonna like control your exercise, see your diet. You know, you had a heart attack, you are gonna be under close monitoring for the diet you take, exercise. They will see the smoking, they follow the medication that you are gonna take, and we will gonna speak about it later on your discharge. Okay.
Which medication, doctor?
Yeah. Actually, you will gonna be about with a many medication. I'm really sorry for that, but it's for your best interest. It will be like a blood thinner medication, a medication, for example, to control your cholesterol, a medication like to prevent any clot, I mean blockage in your blood channels. All right. And a medication to control your heart beat. All of them will be like explained for you later upon discharge. All right.
So, doctor, this all oral medicine, right? So these tablets I can take it home, doctor. No need to stay in the hospital at all. I think no, doctor. I changed my mind. So just give me this medicine, and I can take it at home. And yes, I promise you, I will take it all together, and will be very complaint adherent to this medicine. Just give this medicine, and I will go home.
I'm pleased that you are going to be adherent about them when you are going to discharge, but one of the medication, some of them that will be given like under your skin. It's for blood thinning your medication, and sometimes it's given through blood channels. It need to be given in hospital, and that is why you need to. This is another reason that you're supposed to stay in a hospital. So what do you think?
No, doctor. No, I
May I know
cannot
why?
stay for more than today. Just give me this medicine. I want to go home.
May I know why?
Yes, doctor, because this oral medicine, as you mentioned, that I can take it home and I have a lot of things to do at home.
Yeah, but part of them is not like an oral. Part of them given through an
Okay,
injection.
Okay,
doctor.
time is up.
Yeah, all
Time is
right.
up. Yeah, time is up, Dr.
Okay,
Abdul.
so okay,
Yeah,
my home
give
just
her, give her. Yes, give her.
okay.
Give her the last concern. I mean, tell her.
Uh-huh.
Dr.
Just my
Abdul.
last concern, doctor, just my home near to your hospital and I can come again to your hospital and take this medicine.
I appreciate your concern. I want to tell you that how serious your condition that you had. This kind of a heart attack might happen again. It might have like a complication even after treatment. You might have like abnormal heartbeat that might put your life in danger. So think about yourself and about the lovely ones that you live with them. So what do you think, Mr. Brandon?
Okay, doctor. Okay, doctor.
Okay.
Just
Okay.
yeah, I appreciate you. Okay, thank you, doctor.
Yeah,
All right.
well
Do you have
done.
any other concern?
No, thank you.
All right.
Thank you, Dr. Abdul Manan. Thank you, Dr. Roda. Well done. As usual, as Dr. Sarah said, yes, perfect. And I think
Yes.
she convinced you, but I don't know why you changed mind
I
at the end.
Actually, she did perfect,
Yeah,
and
yeah,
I have
yes.
some difficulty to calibrate the case. However, I changed my mind for one thing, which is hidden agenda of capacity.
Mhm. Yes.
I expect her to say, "Are you aware about the risk that I explained? Can you please repeat this risk for me? Because this is a hidden agenda because he's alcoholic, and this might be due to alcoholic withdrawal. That was one of the hidden agenda of this case."
Yes, exactly. Yes.
Mhm.
But in general, she did well. She tried to
He did
convince, she
perfect.
mentioned
Yes, she addressed
everything, cardiac
all concern.
rehabilitation. Yeah, cardiac
Hmm.
rehabilitation. She didn't forget it. And also about the chlordiazepoxide, which is IV medication, cannot be at home. But if he was hard-headed from the start, Dr. Roda, you can ask him why, till you know what the possible and resolved questions, like any solution you can do, offer just to stay at home because it's very difficult to go with this situation. And at the end, yes, you can ask him to summarize or recap what happened just to
Hmm.
check his capacity.
Yes, because if
This
he
is
has full capacity, he can go home against medical
exactly,
advice and assign a dam.
exactly. But again, after arranging a meeting and at the end, give him the consent form, which is DAMA, discharge against medical advice, and he can go home. But you should know that he's having the fully capacity or the full
Yes,
capacity to go home. Yes, you're right. Apart from this, she did everything, the explanation, the drawing, and the side effect, the possible drawbacks. of the stent, what might happen, and the seriousness of the condition. Yes, your heart might stop, or life threatening. The stent itself, you can say metal tube inside the blood channel of your heart, and it might be also, as you said, change of the heartbeat, or it might be closed by another clot. So he should be in this time for few days, as you said, Dr. Oda, for few days. But if he insists to know that duration, it might be for 1 week, then reassessment. This is the most accepted duration. And you miss the point of driving, because he might go back home with driving, and he has two issues in driving now: the
Yes.
alcohol withdrawal and the PCI itself, which need to be 1 month after heart attack. So
After stent, how many?
so it's written in two ways. If the stent successfully inserted after elective angioplasty, it might be 1 week only.
Yes, 1 week.
Yeah, but if heart attack complicated more than stent, and there is a lot of complication, like this patient, the delirium tremens,
Successful.
successful, but still there is another complication related to his alcohol. So you might tell him after 1 month. So it depends on the scenario, if he's stable after or unstable. If he's stable, 1 week is enough. This is what we realized recently. Yesterday we checked it. But if it's complicated one, it reached to 1 month after the stenting and the heart attack. For example, if patient had arrhythmia post stenting, okay, so it might be extended to 1 month. But most of the cases, if elective with no complication, only 1 week is enough. Clear
Yes.
now? Yeah.
Yeah.
Okay, thank you,
Um,
Dr. Arman. Well done, Dr. Okay, any comments?
Dr. Bassem,
Yes.
yes, when he asked about the medication that you're gonna be taken on discharge, should I say
Yes.
the names like aspirin, clopidogrel, beta blocker?
It's not written in the, it's one of the tasks, but good thing you mentioned to him. You will have a sitting with or meeting with the rehabilitation, cardiac rehabilitation doctors or program. They will tell you about the name of the medication. I
Actually,
agree to do that.
Dr. Basim,
Yeah, go ahead.
okay. Because in the just let me if you back to the
Yes, the scenario.
assessment sheet,
Yes,
in they mentioned that you can negotiate with the patient about the treatment plan. So here, because I think this changed recently, I'm not sure. However,
I don't think. Yes,
the last year, because, for example, patient with pneumothorax, I discuss with the possibility of treatment, either chest drain or aspiration. So here you can mention blood thinning, lipid lowering medicine, and because we need this thinning medicine because of to prevent blockage
yes, of
again of
course.
this stent.
Mhm.
Okay, and you should mention the lipid lowering medication as
Yes,
general, I mean, broadly, no need to go for deep details. However, you should mention this, you should
yes,
mention
I agree if the scenario was smooth with her, but with this argument, with the difficult surrogate, either to try to mention it early, or if you don't have time, as you did, Dr. Saruda, what you did
yes,
for
yes,
me is accepted. We will sit with you another meeting and we'll tell you about the medication names and the possible side effects. If you start to mention
because
them, yeah, it will take time. And already 8 minutes left, and you didn't ask about other support and the job, right? So
yes,
according
I
to the
think the
surrogate,
case can be more calibrated in the exam. However,
I think
explaining
yes, yes.
the medicine, it's a part of her task.
Yes, explain the medicine, explain the condition because he doesn't know. So it's flexible scenario. You can play with the part of explanation either to remove it and just for the Chlordiazepoxide, how to deal with. This is the main task. And another task, the medication on open discharge, you can also manipulate it either to mention the names only, and you can give him leaflet brochure. You can read about them at, before leaving the hospital. However, we will sit with you in another meeting to give you the details about this medication. This is what I prefer. But if you have time, good time to talk about, yes, go ahead. Mention all the medication, the side effects, The compliance, the need to follow up, I agree to do. But I think it will be the separate scenario. Patient, because we did this scenario before. Patient after heart attack to prescribe for him lipid-lowering therapy, atorvastatin, and antiplatelet Plavix. So you will sit and give him the whole drawbacks, and pros and cons, and the follow-up, the possibility of complication, and also the need for compliance, the route of medication. All these things will be in another meeting. This is what I think about another scenario, not this scenario. So this scenario, the last line or the last task was added recently. It wasn't in the main scenario. Okay.
Mhm. So, what about the issue of chlorodiazepoxide?
Yes.
How to discuss it with?
Yes. So it's a medication used for withdrawal of alcohol, and in the best interest for you, as you are dependent on alcohol. And no need here for cage question because he already has dependence, and it's written in the scenario. He is dependent, alcohol dependent. So what you will do, just explain the medication is in the best of interest for you. It's giving by IV through the blood channel. We have to follow up certain side effects might happen, and you have to be compliant on this medication. However, if you left without taking this medication, the drawbacks will be much more than you expect. It might lead to stress, anxiety, even seizure, and might be also harming your life. So he should be under monitoring and follow up, staying at the hospital. And after a couple of days, if his condition is okay, along with the follow up with the alcohol lazy surfaces, he can go home with next follow up. You got it.
Yes, yes,
So it's a matter of he should stay, and if he insists, you should check his capacity. If he's okay and he's insisting, you have to solve all his social life problem. If he insisting, another meeting with consultant, he has a better position to convince him. Still insisting, okay, after checking his mental capacity, yes, it's you're right, and this is the paper phone. However, it's difficult to leave this medication. You cannot take it at home. He should stay. So the task here, you should convince him, and I think with this mental capacity, he will not go home unless he will be assisted by the mental health team.
exactly. One more thing,
Yes.
because the chlorodiazepoxide can
Yes.
interact with can cause rhythm abnormality, can cause shortness of breath. So
Yes, it's one of the benzodiazepine. So
yes,
again, the side effect benzodiazepine, yes, one of them, respiratory depression and even drowsiness. So he cannot go home by any way. And if he insists and you think his capacity is affected or impaired, better to refer him to the mental health team.
exactly.
You will not, I think in this scenario, never ever he will reach to the level of he will sign ADAMA and he will go home. He should be assessed by consultant, he should be assessed by mental health team, he should stay at the hospital at the end.
Mhm.
Okay, so don't
But
give up. Never give up in the
exactly,
beginning. Yeah, don't.
and don't forget to raise issue the capacity. You should
Capacity,
just
yes.
mention that. Can you please, are you aware about the risk that I have explained? Can you please um, tell me recap for me this? If he was has full capacity, then can go further. Otherwise, can be just even under mental act.
Yeah, I prefer to start the scenario asking him about, do you know where are you now? And what's the time now? Just three questions for the orientation, time and place. And the person, if he has, for example, some sitter, or you can ask him whose I am, or something like that. Anyway, the time and place is enough to know if this patient is oriented enough as a test for his capacity. This is I prefer to do this in the beginning. If the examiner thought that you didn't check, you checked it at the beginning. No need. If you lost the time, I mean, and you don't have time to ask him, can you recap for me what happened? Because the time during the argument will be wasted, but at least you reach to a level in the beginning that he's oriented enough to have a good discussion with you with good mental capacity. This is my preference. I prefer to do that at the beginning. Are you Mr. Brandon? Yes, I am. Do you know what time you are? Do you know what place you are in? Yes, I am hospital. The name of any hospital, for example, Mahdi Center or Mahdi Hospital, or we are in the morning now. If he answer you clearly, so at least you checked it earlier because you don't know how the scenario will go through during the discussion and the argument. And if you have time at the end, the point of mental health assessment, you can ask him at the end, can you please recap for me what we have discussed today? Okay, this
I
is
think, Dr. Basim, the issue of understanding and retention is crucial for assessment of capacity. Being aware about the time, place, and person is not enough to assess his
yes, it's
capacity.
not enough. I said just a hint that you did it at the beginning. Then at the end, you can ask him what we have discussed through our meeting. It's a matter of the beginning and the middle, but sometimes the task will not help you to ask all these details during
Yes.
and at the end. As this scenario, there is two tasks: the convince and the point of the medication on discharge. So I mean, you might go through the task and you might not find the time to ask about the capacity at the end. Because you can ask him, yeah, can you please recap what happened? And he will talk for 2 minutes or 1 minute. It will be waste.
Can I ask a question, please?
If you don't have time, that's enough to ask in the beginning and at the end one question only. Okay? Any question? Any question or any comments, please? Any suggestion? Dr. Rhoda?
Yes,
Yes, Dr.
doctor.
Azhar.
I wanted to know if the rehabilitation program for alcohol withdrawal or for cardiac rehabilitation program.
For both. Specifically for cardiac. It's not for alcohol. But now you offer him another service, which is alcohol, because he is alcohol dependent. But in this scenario, it will include, and you will refer him to the alcohol liaison services, okay, or anonymous clinic. You will follow up with him, particularly. But for the cardiac rehabilitation program, it's specific for MI and the placement of the stent and the cabbage according to the surgery or the procedure done for him.
Okay.
Okay?
Thank you.
Yes.
Thank you.
Most welcome. Dr. Azhar, yes?
Assalamu alaikum.
Walaikum assalam.
Can you discuss briefly about what is cardiac rehabilitation?
Yes. Cardiac rehabilitation is a program like in other also disease rehabilitation for asthma, campaign, and it mainly contain the point of exercise, regaining the work, regaining his hobbies, and also it might go through the sex and practicing the sex again after this procedure. So they give him some instruction when to resume all this activity, specifically the exercise. You know, he should be trained gradually, not as aggressive and also not as for sex, particularly he might have some medication might interact with the nitrate and he might have the complication with hypertension, even some patient coming in collapse. You know that, Dr. Azhar, right?
Yes, yes.
So the cardiac rehabilitation program include all these things: exercise, sex, and practicing his hobbies, going back to his work. Okay. Some patients he will ask you, "Can I go to the gym?" For example. Can you let him go to the gym after 1 week of this stent? His heart still needs some time to rest, right? Or at least it will be like gradually, and this is the job of the cardiac rehabilitation. Okay, let's go to the next scenario.
Just
If no
one
more
minute.
question.
Yeah,
Yes,
just one. I'm not sure. Maybe I missed this
Dr.
point, but
Najla.
Yes, hi.
Yeah. How are you?
Yeah, just wanted to ask, how did you explain the chlordiazepoxide and the need to stay at hospital to continue taking it? Because if I'm not wrong, continuing chlordiazepoxide for alcohol cessation program, it needs like daily see what's scoring and follow up of the patient and dose adjustment and so on. So how we can explain this?
Yes, we
How it
need
is
to monitor
explained in
you.
the
We need to monitor you. We'll follow up with our team, specialized team for this medication and for the alcohol. This is the way, because if you stop it gradually, that it might relapse again, the symptoms of alcohol withdrawal, and even this benzodiazepine as withdrawal. So he might have complicate with withdrawal of either alcohol or benzodiazepine, because chlordiazepine used is benzodiazepine used for the alcohol withdrawal. So both of them need to be monitored in the hospital. You got it, Dr. Najla?
Yes, so I can clearly mention that I'm deeply sorry. I can't give you this one to be taken at home because it needs
Yes, of
close
course, yeah.
monitoring. Yeah.
Yes.
Okay.
Even at the point of I am near to the hospital, I can go home and come
Yeah,
visit
we
you.
can.
No, it's not the point.
It's not
It's
a
not a
medicine that
matter,
can be taken at home.
yeah, it's a matter of monitoring what will happen if you stop this medicine or if you decrease the dose. We are titrating the dose because all
According
this
to the response.
yes, this medication need to be withdrawal gradually.
Okay, thank you.
Most welcome, Dr. Najla. Let's move to the next scenario. If no more comment, Dr. Rida, can you post the scenario?
It's in the group.
Okay, in group. Also, he can drive. So we mentioned the driving point. Either 1 week if it's safe and uncomplicated procedure, or if complicated heart attack, it might reach to 1 month. When he can take flights, any procedure need at least for the flight 1 week if it's safe. It's 1 week, okay? Driving itself, yes, of course. Need to be all driving for 1 month. The color dioxide can lead to drowsiness. We mentioned this, yes. I think the question didn't ask the candidate to convince the patient to stay clearly. It was confusing to waste time to execute treatment and discharge on convincing him to say. Yeah, she didn't convince him earlier, that's why he raised it again. I guess so. So need to be convinced well. And you can confirm, Dr. Roda, are you okay now, Mr. Brandon, to stay at hospital to continue our program with you? Yes, doctor. So close this point totally. But if you didn't take the approval, he will might renegotiate with you again. Doctor, no, please let me go. So better to get approval on time. Are you agree now to continue our plan? Yes, doctor. Okay, that's good. Thank you. I will bring the scenario if no one can post. Which group is Dr. Roda? Yes, I got it. Dr. Aminam, you read the scenario in order to be ready?
Yes, we can start.
No, I will post it and I will read it. Sorry, because some doctor didn't see. Okay, Mr. Jonah, sorry, Mrs. Joanna, 25 lady. She had given birth to her second child 1 month back. Pregnancy was complicated by polyhydramnios and ended in a premature birth at 35 weeks. Her premature baby daughter was admitted to the NICU because of neonatal ICU because of severe breathing problem, where she was intubated and ventilated for 10 days before gradually weaned off the ventilator but remained under intensive care for further 2 weeks. Diagnosis of congenital dystrophia myotonia was eventually made by the pediatric team, but that diagnosis was not communicated to her as she was not in good mood. However, she is aware that her baby daughter was floppy and has problem in breathing due to muscle problem. Symptoms include difficulty in breathing, swallowing, and become floppy. Prognosis disease is progressive. Mode of inheritance is autosomal dominant. This disease has anticipation. The task explain diagnosis, anticipation, treatment, support group, and available and further plan. A support group available. Okay, I will reset the timer. I posted the scenario as well. Everyone can see it in the chat box. Download. Now you can start, Dr. Minan. Here you go.
Hello there.
Hello.
My name is Dr. Ahmed, one of treating doctor in the clinic today. May I confirm that you are Miss Joanna, 25 years old?
Yes, yes, doctor.
Miss Joanna, we are here today to discuss some issues related to your daughter. Is it okay with you?
Please, doctor. Yeah, please.
Just to be in the same page, can you tell me how much you know about your daughter's health status?
Thank you for asking me. I don't know, doctor. You know that I gave birth for 1 month for my baby, and she has been admitted to the intensive care unit for the babies. They told me that she had a breathing problem, and they put a tube inside her, and this for 10 days. It was disaster actually. And now she's out of this breathing machine, but I don't know. I have a concern. But they told me that she need to be stay in a hospital further, and I don't know when I like start like to carry her on something. It's not like my previous child. I feel she's a floppy. I don't know what is going on. There is something wrong with this child.
Well, thank you for sharing this with me, Miss Joanna.
Mm.
So, do you have an expectation what could be behind her symptoms?
No, no one explained for me what is going on with my child.
Okay, I'm here for updating you about your daughter health status, and after assessing her, the child consultant he already reached the diagnosis and the exact cause of your daughter problem. And I'm so sorry to tell you that I have bad news for you today.
But tell me, doctor.
Well, our consultant confirmed, diagnosed your baby with a condition called congenital Myotonia dystrophica.
I have no idea about this.
Okay, well, let me explain to you. Congenital Myotonia dystrophica, it is a genetic, familiar problem that means run in family. The exact this disease affect the muscle of the body, including the muscle of breathing, including muscle of her limbs and swallowing, and explaining the symptoms that and explain why she look floppy when you are carrying her. Well, I'm so sorry to tell you that, Miss Joanna, it is a progressive disease. That means it is at the end it worsening, and it has some complication like in advanced stage even might can cause severe and serious breathing problem. I'm so sorry to tell you that. However,
What you are telling me that my little child is gonna die?
I appreciate your feelings, and I can understand what you are feeling now. However, I want to assure you, you are not alone on this. We will keep her in our eyes. We will keep and we will follow her minutes by minutes, and we will keep in regular follow up. And I want to assure you that we will give her best care, and we are here just to help her and give her best of care.
So no cure?
I highly appreciate your concern and I can understand your feelings. I'm so sorry to tell you that congenital myotonic catastrophica has no cure. However, we can control the symptoms. We can give her support, can support her breathing, and can if even develop this difficulty of feeding, we can help her on this. However, there is no absolute cure for this disease. I'm so sorry to tell you that.
So she will gonna die, as I understand.
No, it's not like that, and that what not I mentioned. However, there is. However, just I want to explain to you. I'm ethically bound to explain everything about this disease at the same time, and I want to assure you, you are not alone on this. We are here to help her and give her best of care that we have. I hope you understand this point, Ms. Joanna.
And you told me that it is genetic. The thing that I understand, and you tell me it's familiar. No one in the family had this.
Mhm,
Even me or her father. No one.
Okay. Well, yes, it is a familiar disease. That means, okay, let me to explain. Familiar, that means run in family. And regarding there is no, might be a new defect in her codes. I mean, what's in medicine we call the gene, and might be even past this in previous and her in old generation. I mean, past without notice. However, this is a familiar disease, runs in family. And one more thing, just I want to explain for this disease. This familiar disease has a specific feature, which is called in medicine anticipation. That is means anticipation means. I'm so sorry to. I know this is hard to deliver in one meeting. However, just let me to explain to you what is anticipation. Anticipation it's a special kind of inheritance. That means the disease delivered or I mean transfer from mother to her offspring, and the upcoming offspring might have this disease earlier and more severe. I'm so sorry to tell you that, Miss Johanna.
I have had hand pain, doctor, and this is for a long time. Could it be related to this disease? And by the way, my mother had a eye problem. I don't know, it's called cataract or something. Could it be related, doctor?
Well, and how is your mother now?
She's all right, but and she did like a procedure for her this cataract. And thank you for asking. But could be related to this disease?
Well, for now, it's difficult to mention to assess to judge without seeing her and assess her. That is why we can arrange another meeting and involving you and involve your mother, and just we will be happy to help you and assess you, and will update you about anything after assessing and examine her and giving some necessary tests. Am I clear
And,
so far?
yeah, and I have also another child, as I told you at the beginning of the meeting. She is only 7. Um, and this disease, I'm really concerned because you said it's familiar and it runs in the genetics. And can we do like any specific test for this child?
Well, as we have discussed, this is a familiar disease, and as a part of protection, we will arrange another meeting involved, and we will assess all your children, and
2 minutes left.
and we will involve our child doctor and genetic team, and one might need to do some tests, because every one of your children has a 50% chance to have this disease. That is why we need we need to assess him again, and we arrange another meeting. Am I clear so far?
Yeah, so what you are gonna do for my baby right now? How you are gonna take care of her? What the plan?
Well, okay, I understand your feeling, Miss Joanna. Well, regarding your baby, we will keep her, and then if she develop any breathing problem, we will help her in this breathing problem, and as we discussed, there is no cure for this disease. However, if she
Mhm.
develop any problem or any breathing or any problem with feeding, we will give her a best treatment. And at the same time, I will give you a contact number of supporting group, and the parents who have sharing the same problem of your daughter, they and this they can discuss together, and they these groups have supervised by specialists. They will inform you and update you about, give you more detail about the disease, and they will even give you support for this. Ms. Sophie,
So,
can I ask you some social question if you don't mind?
no, because I have another concern. What are the
Okay,
team
yeah, sure.
that you are, what are the team members that will gonna take care of my baby? She has a breathing problem. Her muscles is floppy. What
Mhm,
are I cannot take care of her in the home, by the way. I need
mhm.
help.
I highly appreciate your concerns. This team involved, including the child doctor
Mhm,
and chest doctor
mhm,
and speech and language therapist who's
mhm,
responsible for feeding, and
mhm,
also involving the social worker, and we will
mhm,
discuss this issue if and to see how it's helping us in this regard, and how it can help us to take care
mhm,
of your baby at home,
mhm.
and also involving specialized nurse uh, for specialized in this in such cases.
Yeah,
I
but
hope.
and I cannot take care of her alone in my home. I am a I'm now I'm a divorced doctor.
Mhm. Well, okay, in such, we will discuss this issue with our social services and see how they're going to help us in this regard. But don't worry, we are here for you, and we are here to help you.
Thank you, doctor.
Okay, time is
Okay.
up. Time is up. Thank you, Dr. Roda and Dr. Abdulmanan. Yes, Dr. Roda, please, can you comment first?
You did great. Just few comments, like in the introduction, you can ask for someone to attend the meeting because it is a bad news.
Mm-hmm.
So you explained the disease well. You told about the complication, and when she asks you about is she going to die, you can say for her it's
Yes,
a kind of a difficult question to be answered, but I'm really sorry to tell you that this kind of disease might shorten her
yes,
life.
agree.
Because it will might shorten, it really will shorten her life. But don't
Mhm.
worry, we are going to support you, monitor you, and you can now tell about the anticipation and so on. And when what else? When she asked you about she had a hand pain or her mother had a cataract, yes, you can tell her it could be, and as you said, and could be or could not be related. We need to assess them, and you now open the issue of the genetic counseling, because here important, it is a genetic disease, might need a genetic counseling. We will refer you, put it with the team that you told, that the child doctor just the genetic counselor refer her mom, and herself refer her to the genetic counselor, because they may agree for a genetic test, and this need a consent. It's a legal issue. When she asks you about, she has another baby, she has her child 7 years old, also open the issue of the genetic counselor, and you can tell her, but we will refer you to the genetic counselor to see what they will gonna do with this, and there is a 50% chance, as you said. And what else? You can tell her that this disease cannot be, if the child has the disease, it cannot be prevented. So I'm advising you, in my opinion, not advising you, in my opinion, better to wait till the child have 18 or 20, to have decision by him or herself, and to decide by itself.
Yes,
Uh,
I agree,
uh,
professors.
yes, and what else? I think that's it. No
Yes.
comment.
Okay, perfect, Dr. Roda, and well done, Dr. Abdulmanan, by the way. You did well. You are very
Yes,
sympathetic and empathetic. Your way
and
to
last
think.
thing, last
Yes,
point, Dr. Basim, just not to forget.
yes, yes, yes. No, go
Yes,
ahead.
After any concern, don't say, I appreciate your concern. This is a good concern. I highly understand your feeling. So, يعني, just don't like to repeat yourself. Some concern you can like answer them like directly, and other you can say like that. Just عشان don't be like repeating yourself. عشان يكون الكلام شيق.
Okay.
That's it.
For this point, it's according to the scenario. If the scenario is crowded of points and ideas, yeah, better to answer quickly.
Yes.
But if the scenario is few points to mention, okay, appreciate and valid concern and everything. But I think the
Even
scenario
Dr.
is
Mohammed
large
Abbas
one.
said, yeah, Dr.
Yeah.
Mohammed Abbas said, don't say, I appreciate your concern. This is a valid concern. I was saying like that before. But he said, no, no need. You can say it 1 or 2 times and that's it.
Yeah.
Yes.
Okay. Okay.
Thank you.
Okay. Thank you, Dr. Ruda, for the case. And again, Dr. Abdullah did great. The point of encouraging for screening, as Dr. Roda said, no need to mention it. We can wait unless there is symptoms. I will start point by point. It was the last point. So whenever the child has no symptoms, let him enjoy his life. No need to rush for the test. Whenever he reach the age of 18, he have the choice and he can decide either to go or not. However, it's not encouraged because it's not curable disease. Whenever he has symptoms, please let us know. This is for the first point. The second point of will my baby die? Yes, honestly, be honest, yes, and say it clearly. It's a disease, progressive one. It's written, by the way, in the scenario, Dr. Amina. Written down in the scenario. It's very poor prognosis. Why you are saying no, we will try? No, it's the truth. Be honest. Yes, your baby might die, and this disease known, especially the congenital one, known to shorten the life of the babies. They might suffer a lot if they survive. That's why they are on the machine and the machine trying to support the breathing. However, if the machine is not there, they might die. Be honest, because this patient really will die. You let her think about taking the baby home, which is very unreliable. No one can take this baby home. Because of your support, she thought that, yes, doctor, I don't want to take him home. I will suffer with him. No, he will not live till that moment. He will die or she will die soon, maybe days or couple of weeks. Okay, and in such situation, better the baby will die. Otherwise, they will be ventilator dependent forever. So better to give her the truth from the start. I am afraid to say yes, it's a very dangerous disease, especially in such age, and I'm afraid to say yes, she might die because this disease is known to shorten the life of the babies. Okay, this is because the concern raised again when you told her no, we will give the maximum support, we will let her breathe support. It's not that supportive thing, it will be very depressing. She will die soon or later. So don't give the support. Yeah, support the mother. We will support you, we'll do, but the baby, I think she will not or he will not live long. Apart from this, you did great. Yes, I think for the clinical judgment, you did well. Apart from the point of dying, so you can take borderline in this scenario. And for the clinical communication, you did great, satisfied or satisfactory. For the consent and welfare, also satisfactory. For the previous scenario, I guess Dr. Roda also can get borderline in the clinical communication. This is my opinion. For the point of driving, okay, she didn't mention it or she didn't ask about it. And for the clinical judgment and the other point, she can get also satisfactory. So I think both of you will get the same mark, but in different
Okay,
scale.
just I
Yes.
have one question regarding
Yes.
the family screening in
Yeah.
case of myotonic dystrophica. In such case, for example, the especially with the anticipation, so we expect this disease can get the disease soon, right?
Yes.
So if I discover the disease earlier, Even if he has, for example, heart block, I can do procedure. For example, I'm not sure, should I never advise for screening in such case?
It's not never, no, it's not something to be encouraged for. But let's take another point of view of fertility. What do you think this female, if she want again another baby, will you proceed with the genetic or no?
It's not like for pregnancy. I'm concerned about, for example, for her health. If I discover
Yes,
the disease
but
early, I
you will
can.
encourage for gene selection, right?
Mhm.
Yeah, and blood pressure, okay, yes.
So
Okay. So if for the mother, for me, I will not screen the mother. I will treat the cataract. I will do what the patient symptoms have. I will treat what the patient symptoms have only. I will not do a genetic for the mother. What the benefit of screening the mother? If you diagnose the mother with myotonia dystrophica in this age, she had the gene. What the benefit of diagnosing her? She already 60, 70, or whatever. She will live the remaining of her life in stress, right? I will not encourage for the mother. For the grandmother. For the mother, I will encourage in case of she want to be pregnant again and she want to have safe baby. I will encourage her. Yes, you can do genetics counseling. I will refer you to them. They will have ideas if you want to plan for another pregnancy. For the son or the child, I don't encourage at all. Whenever he reach the age of 18, let him decide if he wants or no, because this screening have pros and cons. Let him know and he will decide accordingly. Okay, this is my opinion again. For the mother, yes, unless she need. For the grandmother, no need at all. For the baby, let her decide when she get 18. Yes, Dr. Azhar, go ahead.
Why we have selected this age 18 years? He can, the
Because
patient can take decision at the age of 18.
yes, only for the decision, yes.
Oh,
Okay, you can't do it without his approval because no benefit from the screening. But let's imagine another scenario for Hocam. Do you think the screening for Hocam is okay for less than 16?
yes, yes, I will.
Yes,
yes,
exactly. Because it's
It's a
also
benefit.
non-invasive. You can do non-invasive,
Yes,
but for the genetic, if the patient or if there is certain situation like sudden cardiac death in the family, if the patient is doing hobbies, going to the gym, or he is doing some sports like football player, professional football player, he need first do non-invasive echo. If the echo is not showing features of outcome, you can or they can do for him the genetic testing. This is different because he might have treatment, but for that myotonia dystrophy, no treatment. Even in the discussion yesterday, we said only supportive occupational therapists, orthoses, some physiotherapists, but nothing to be offered for him as a
okay,
medication.
Vasan.
Yes,
In the explanation of the disease, likewise, as Dr. Abdul Muni said that he has a breathing problem, the baby. Can we say like this? If she survive in future, she may develop cardiac problem, she may develop diabetes, she may develop eye problem. Can we also mention this in the explanation of the disease or not? There's no need.
I think you can touch it. Yes, there is muscle. It's a muscle disease, but sometimes it affects other organs like heart, like eye, like nerves. I agree, but if you have time, according to your scenario, here you have to talk about the daughter and the possibility and the prognosis and the outcome, and you have to talk about the screening, either encourage or discourage. And according to the sometimes some scenarios, you will finish the task and you will have adequate time to raise these issues. But other scenarios, like our scenario today, is both of the scenarios were crowded of ideas and points. So you cannot talk a lot about other things which is not necessary in this scenario. For me, this scenario, if you want to explain the disease, muscle, breathing, the major issues for the adult one. But your scenario was about the baby. congenital form, and the congenital form now is very poor prognostic one. You have to talk about the possibility of death and support for others, family member, and the genetic counseling point, but don't encourage if she raise it, okay?
Okay.
Any other
For the mother,
genetic?
we can
Yeah.
for the mother we can ask the mother that she also go to the genetic counselor before the next pregnancy.
Yes, this is the only situation she can do. Apart from this, no need unless she has symptoms. If she has symptoms, yeah, come visit us. And you can, this time, you can tell her the symptoms she might face, like weakness, difficulty of holding the things, opening the jars, swallowing problem, vision problem, diabetes. This time you can counsel about these things to the mother, but the
So
scenario is not about the mother, it was about the child. But if the
yes,
scenario about the mother, yes, explain and tell her these symptoms as red flags. Whenever you feel this, come to us. Or if you are planning for pregnancy, visit us. We will refer you to the genetic counselor team and they can deal with you with a safe pregnancy after selection of the ova or the eggs.
so Dr. Basu, as we discussed that this for myotonia dystrophica, this genetic testing should not be done before 18 years, or the patient is
Yes,
having signs and symptoms. So mother
yes,
is already more than 18 years. So
yes.
should we explain him that whether you want baby or not, you should go for the genetic testing. Should we say like this or not?
Only if she has symptoms and if she's planning for pregnancy. Apart
And
from
if no
this,
symptom,
if no
we will not
symptoms,
say
why you
anything.
will screen? You will put her under stress only. She will know that she is carrying the gene. Without babies
Oh,
or future babies, she will be living in stress condition. I have the disease, and she will be stressed all her life and might live longer without any of these symptoms. But if she has symptoms and you suspect she has the disease and the disease will progress, and she chose by herself, by the way, if she asks, no, please, doctor, even with this cause, I want to do the test. It's her right. Refer her to the genetic counsel. They can tell her about the possibility, what to do, and the pros and cons again, and let her decide. But if she asks you and insists, yes, refer her. If not, it's not preferred to do the test because it carry the cons only with no pros because no treatment or no cure for this disease. Clear?
yes, yes. Thank you very much.
Yeah. Unless also she want to be planned for pregnancy, yes, you can advise here. You can encourage only in this time. Go to the genetic counselor. They will sit with you to send you to the fertility doctor and you can get an ova which is clear from this disease. Means genetic or gene selection. Okay. Okay. Thank you, Dr. Azhar. Is genetic jargon? I don't know. Genetic? Yes, better to say the code. But the genetic team is one of the teams. So you can say genetic team, which is the team responsible for the code and the code selection. But better to explain it, as Dr. Aminan did. He did it perfectly. He avoid all jargons. So whenever you say gene, you can say the code, or the code is a gene, and so on. Any comment? Any question? Dr. Dalia?
السلام عليكم.
وعليكم السلام. Welcome back.
ازيكم؟
Long time.
أيوة زمن طويل. يعني good discussion و nice case صراحة. بس عايزة
Thank
أقول
you.
للدكتور إنه
But
يعني
I will ask you, please, Dr. Dalia, because we have non-Arabic
okay
speaker in English. Yes, please. Go ahead.
okay sorry for non-Arabic speaker. Just to say, this is a tough case. Usually, the genetic cases in the exam is usually tough because the concern might sometimes could affect your clinical judgment if you didn't deal well with the answers and be very assertive and careful. Um, um, and actually, the surrogate was tough as well, and the examiner. So in such cases, try to, especially when cases like this come again and again in the scenarios of exams, and so it's better to have a good knowledge about the case, about the diagnosis, to be very confident and assertive on the description of your answer or whatever. So from start, I just advise to be from the start, just to go to have a good rapport with the mother, and to deliver the bad news as early as you could. And so I've just noted that it spent a longer than it better would be. Okay, is to um, for example, if by the way, sorry for that, this is not systematic way, but they have there is a question, or there is marks for the a question that how are you so far, or something, just before to go for further discussion. If you ask the patient, particularly with any disease counseling, so especially this woman has just delivered her baby, so you need to ask about her well-being, okay, just to make sure that she's okay. That you'll have a mark in the mark sheets, there is mark for that. Okay, and then after that, there is systemic way to describe the disease. So if you follow that, there is a mark for to be systematic. For the mark sheet, there is marks there. It's for be systematic. They will give you marks. You've mentioned most of things that you need to mention, but for a while you feel like you are jumped from point to point, or and I know that because the surrogate is rushing you with questions. I noticed that as well. So it's not your problem, but the better way for for the listeners, that they especially as I'm not a doctor, so I couldn't have a good idea about the disease, like overall, it might be some confusing for to understand that. And surrogate have good knowledge, so she didn't feel like play the role of I'm not understanding. She just catch the disease and just try to talk about that. I'm not sure I'm making myself clear or not. But for example, if from the start say this is a familiar disease, by the way, genetic disease is a jargon, and try to, when you said, they will mention the terminology of the diagnosis, not wait a while until the surrogate asking you about what you mean.
Mhm.
Okay,
Yes.
just try to be like very smart. Don't bother
Yes.
yourself with these terms. Don't bother
Mhm.
yourself. This is a good phrase for such case. Don't bother yourself with this name. It's a disease, it's a familiar disease affecting the muscles, and unfortunately this is a progressive, that's mean is progressive breakdown of the muscles, okay, affecting damage in the muscle all over the body, and sometimes affecting glands, eyes, and the other, like the other candidate mentioned, you need to give her this generalized disease. It's affect many parts in the body, and you could, if you miss something about the explanation of the disease at the end of this, at the end of the session or the consultation, you need to mention, I will provide you with the links to understand more about the details of the disease, and brochures or leaflet about the disease, so everything will be clear. And if you have any question, we are ready, we are here for any questions that have might you need to be answered, or anything like that. But try to give, because patients usually don't like to understand more details or deep details. Just where is the disease? This is generalized disease affecting muscles. and could affect the swallowing muscles all over the body, and some glands in the body could affect even eyes, okay, and heart, and could be it's a very serious disease, particularly in your case. After you give the breaking bad news, and you are very good in breaking bad news, I just have you about just to ask about how do you know about the disease. She will say the normal thing, said no, I don't have any idea about that. This is affecting muscle generalized, and that is the bad thing about this disease. It's what is called anticipation. And these terms mean don't bother yourself. These terms mean it's run down or come down in generations. That means as you've explained it, it's from generation to generation. It's come earlier and worse and more progressive. And unfortunately, your daughter has this since birth, so that it's very, that's the outcome is not good. I'm sorry, as you mentioned. And then just for they could take from you marks for the answer of the question for that is not killing disease. I'm sorry, this is it the it could, I don't know how to say it, but it's she asks you, is my child gonna be die? You could say absolutely. This will affect the lifespan of people, and when it comes earlier, it will have a poor or not poor. It's worse outcome, for example. And I'm really sorry that your child might die earlier than it should be, or could die early. I'm sorry for that. But if you are honest and give her that no false hope, this is a key here. This is I guess that the examiner waiting to hear that you are not giving her a false reassurance or false hope. Okay, so you need to be yes, affectionate, but at the same time assertive and very honest. Okay, and then after that, I just have a recommendation for don't take the job of other team member. For example, all of us know that this patient, this genetic cases, it has to be refer to genetic counseling. They know how to deal with all the details, and this is his job. So don't bother yourself with the details and everything. And for example, not to encourage or discourage or so. You will give her the clear idea about that the referral, whatever the case, by the way, Dr. Basim, whatever the case, the mother need to meet to see the genetic counselor, okay? Because if after that she might to understand about the disease and what that everything about the disease, because of course it's genetic disease. Okay, so she's in need to go to be referred to genetic counseling team. Okay, then after that, this is their job. If ask you about anything, it could give a brief idea and a very short idea, but let her know that this is will be very clear by the genetic team. They know the details and they know how to deal with that thing. Okay, we refer you to our team, the genetic counseling team. Okay, so and then for the one question, the complication is important. So they when they ask you about what the outcome or that, it means it's because this is affecting the muscle. It could lead to severe chest infection. It could lead to a severe disruption of the electricity of the heart. This could be or affecting the bowel, okay, affecting the eyes, affecting everywhere. So it depends. So that's why it's vary to know how could be the outcome for everyone. So uh, um, that I guess that's all I need to say for now. Thank you. Sorry for it took a long
Yeah,
time to explain.
thank you, Dr. Daria. I agree with you. Whenever it's safe to say, I will refer you to the cancer team or genetic cancer team. They will give you, and they are in better position to give you more details about the screening. But
Yes,
I'm
yes,
talking about if she asks in details, I want or I don't want. Anyway, it's better. Yes, as you
yeah.
said,
You
it's better to
explain
refer.
well, by the way, Dr.
Yeah,
Basim, you explain well to the doctor later. But
Mhm.
from the start, you might give
Yes,
not real impression about your understanding. You got me. So
yeah,
when
yeah,
you try to say the pros and cons, by the way, the 18 years, the policy is better not to say this is not good and as like it's your own idea. No, you need to reflect that for to be very clear for the surrogate or an examiner that for the screening for the child. Say, I could answer. That's good question, by the way. That's good question. Usually for kids, at the policy, we can't do that genetic testing. Sometimes the surrogate have a good knowledge and the level of the knowledge is good. That's so genetic might be not a jargon. If the surrogate said genetic by his tongue, that's mean it's now you could say it many times. Okay, so you said this is by the rules, the policy that we can't screen um, kids under age of 18 until they are, because there is pros and cons. They need to take their own decision when they are grown up. Okay, so they need to take their own decision. Okay, and to take the responsibility of the decision, whether it's positive or negative. And it's sometimes, by the way, sometimes whether it's positive, as Dr. Basim said, or negative, it sometimes it wouldn't affect only just that affect the people emotionally and affect their life and quality of life. So if there is a benefit from that, okay, usually they be encouraged to do that. And this is not our job. This is a counseling team job. So we will say that to know more and to the take and to have your time to understand and to take your decision based on knowledge. So you need to have a meeting with the genetic team to give you more and to think about that. But for the moment, just your job is to give that plan. What
yes,
just yeah, just concentrate and focus what usually patient want from the meeting. They want to know what exactly happening and what the situation and what the plan. Okay, and with some question, but the cornerstone of the meeting to know the plan will be here in the hospital, so it's written. Try to read
yes. It's yeah.
the scenarios very well and digest
Follow
it,
the
and you
scenario.
need to follow the scenario. This
Yes,
is his
exactly.
mention here in the scenario will be for more 2 weeks in the ICU. Then after that we'll do a assessment and you could know what the plan is at the end. If they ask you, I can't deal with the baby, don't worry. There will be a team would support you, and we will after 2 weeks, after the intensive, the team will sit with you and explain everything and how could help you. Don't worry, we wouldn't leave you alone. Okay, just like that, she will get reassured and she will feel that okay, she wouldn't ask you anymore because she needs help. She need to understand and she need to have a good sensible plan.
Yeah.
Okay. So if it's sensible, and then after 2 weeks, she will be with us for more 2 weeks. Now, you need to explain that she was on the device assisting her breathing, the baby breathing, and now they took off that machine, and she will be in the ICU, intensive care unit, for more 2 weeks. At this, the plan was done so far. Say so far, okay? That up so far, she will be on the ICU for the next 2 weeks, okay? Then after that, the team will assess her. Then you will be updated about what the plan will be. Okay, and
Yes.
don't worry, we'll support you, and I provide you with the leaflets about the disease, our website, to know more about that, and we'll refer you the counseling team. Okay, and we'll have be sure that we have meeting with you, because this is a bit complicated, and I know you can't, this is a lot to take right now, so we'll be step by step with you, don't worry. Okay, give reassurance, just outlines, and she then after that she will stop put too much question with you, because she understand that there is some steps will gonna be meetings, follow-ups, and more knowledge about that by websites, that thing. Okay.
Yeah. Thank you,
I'm
Dr.
s-
Dalia, again
I'm
for the
s-
explanation and clarify. Yeah, I like this comment. Some examiner don't like, I understand your feeling. Better not to say, yeah, yes, just appreciate, don't understand his feeling, because never ever you will feel his feeling because you are not in his position. Okay, thank you, Dr. Abdulmenaim, Dr. Roda. Any question, any comment before ending the session? Nice discussion again, as usual. Thank you, Dr. Dalia, also for your comment. Probably one advantage of doing genetic testing earlier in males, so we can extract sperms and save in bank before testicular atrophy for fertility issue. Yeah, good point to mention. Thank you, Dr. Ahsan. Thank you so much. Yeah, this is in case of male patient. Yes. Thank you, Dr. Ibrahim. Thank you, everyone. Thank you, Dr. Abdulmenaim and Dr. Roda. Any question?
Hello.
Yes, yes.
Yes, Dr. Basim. I want to ask about
Hello. Yes, we can hear.
the scenario appeared recently by pulmonary embolism. It's CT reported firstly the patient have VE, but the senior radiologist changed the report, and already the patient started anticoagulant. My question: this is a medical error or what?
Yes, suppose the report will be written as the final. However, if it was initially written without revision by consultant, in the best interest of the patient, he should start, or the patient should be on anticoagulant. But for changing the diagnosis totally, it should be medical error and it should be raised as incident report, because the anticoagulant was started based on this report, and if any harm happen, it will be big dilemma. So it's a medical error. And by the way, they will write on the task above in the scenario, is it medical error or not? So it will not be uncertainty. It's clear going with medical error. Clear?
Because when doctor he said this is not medical error, because
Okay.
in the hospital there is a local policy. Firstly, the report should be written by the registrar or any junior, and written this is a preliminary report. It could be changed by the consultant, but I
Yes,
don't know.
it should be written after revision by consultant. So the details of the scenario also is not clear. If he wrote it after revision or he wrote it by himself and after that, it will be more clear in the exam. If anyway, if you can bring this scenario and we can practice it after tomorrow on Thursday, send it to me privately, okay? If you
Okay,
have
okay.
it, yeah, please. We will
uh,
practice it, inshallah, after tomorrow.
excuse me. Could I
Yes.
add something? Just for this case,
Mhm.
just make is not all the scenario will be the same. So read the scenario very well.
Yes,
If
exactly.
you feel the scenario guided you that it's a medical error, go with that sense.
Yes.
If it's uncertainty, for example, if they brought the patient for you in the ER and the patient is hypoxic and tachycardic, and you will find that like everything is going with the PE, and you can't wait until the report of the radiologist has come. It's not a bad practice too. It's just explain to the surrogate or the surrogate that it's in the scenario that give that ask the patient what do you know about for your father condition or your condition or anything like that. And after she said that he came with a severe chest pain, short of breath, and was yeah, I agree with that he had come with the very critical, say this way, he was in critical, just to just to justify yourself later on. So he was came very critical, short of breath, and the doctor out there just want, because this is our job, is to save lives. Okay, that it might be because this is one of the top emergency, that it might be the case. So one of the practice sometimes is to give the treatment if the intention is to the best interest of the patient, or to give the treatment to save the life. And we could stop it later, unless in the scenario there is something is very contraindicated for this situation, for example,
Yes. Or
pulmonary
contraindicate.
aneurysm or something that's
Yes.
very
Yes.
contraindicated for that. So
Exactly.
it will be in a position that it's really need to be. And and just try to absorb the surrogate anger, and before that just make the surrogate some words that saving lives, and the intention of the doctor at that time and
Yes.
was is critical. Just they try to give him oxygen and to try to support his blood pressure, and so and so and so and so mention what the effort that was done at that time, and just explain. And after that, when there is because they can't wait at that time the result. And if you feel that, just say what you see that from the knowledge background as a doctor. And sometimes if convincing to the patient, just don't made up anything, don't lie, be honest, but at the same time give that it sometimes it might be sensible. Okay, then after that, if you feel the scenario guided you to the one way in very clear way, just follow
Yes.
the
Yes.
scenario. Okay,
Exactly.
thanks.
Yes.
Okay, thank you, Dr. Dal.
Thank you. Thank you, Doctor. Again, send me the scenario and let's practice after tomorrow, inshallah.
Okay, inshallah.
Okay. Thank you, everyone. Thank you, Dr. Daria, and everyone. See you, inshallah, tomorrow. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.